And now your host, Dr. James Haney.
Thank you and welcome to the show this morning. The topic this morning is Meharry's AIDS projects. And we're fortunate to have with us this morning to talk about Meharry's AIDS projects two persons from Meharry Medical College, Mr. Richard Frankel, who is a coordinator for a trials program dealing with AIDS at Meharry Medical College, and Ms. Pamela Emmons. Ms. Emmons is the coordinator of the SHARE, S-H-A-R-E project at Meharry Medical College. And let me welcome both of you to the show this morning to deal with this very, very important issue of AIDS. Mr. Frankel, before we get started, let's have you and Ms. Emmons give us a little information about your background and education and some of the things that were important in both of your lives in leading you to the present positions that you're involved in.
Well, I came to this position kind of circuitously. I was born in Ohio and educated there. Came to Nashville about 14 years ago. My major area was communications. Was in the radio business for a short time, in the newspapers for a while. Came to Meharry about 10 years ago to work in public relations and public information. About 3 years ago, I was talking with the principal investigator, which is basically the faculty member who holds a grant on an AIDS project, and she interested me in coming on board with their project. So I made the shift into that as the administrator for that project. The original project I was involved in involved 8 colleges and universities around the country, what we call the AMPS schools, the Association of Minority Health Profession Schools. Our thrust at that time was to develop a center among the 8 schools to do research in AIDS, which historically and up to that point had not been done significantly in black populations. As an offshoot of that, we ultimately applied for and received what's called an AIDS Clinical Trials Unit grant. A year and a half ago, 4 of those grants were given principally to minority institutions. Meharry, Howard in Washington, the University of Puerto Rico, and the University of Hawaii were the 4 recipients. Our grant is unique in that we coupled with Vanderbilt University. We presented at Meharry the expertise in attracting black populations into the trials. They presented us with expertise in how to conduct a trial. And so we created this partnership, which is unique in the country, and have launched the project. It's about a year and a half old now, and we're beginning to make significant inroads now into the populations.
Very good. Ms. Emmons, what about you and your background?
Well, I was born and raised in Birmingham, Alabama, and I went to school in Nebraska and Colorado, and I'm a nurse by training. I came to Meharry in 1982, and I've just done various things. 7 years ago, I worked in the Clinical Research Center, which basically is some of the things that Richard is already talking about, just various issues that affect black people. And I was involved in doing some of the trials and everything there. And then, like I said, about 3 years ago, Meharry then had an opportunity to work with our Project SHARE. And Project SHARE is stands for like Specialized Health Education Aimed at Research and Education. And so 3 years ago, I got involved in Project SHARE, and we'll talk a little bit more about it, but basically, taking care of HIV-infected mothers, pregnant mothers and their babies.
Very good. And so both of you bring with you information and experiences dealing with this as a topic and this as an issue. Let's talk about, Mr. Frankel, some of the aid projects at Meharry Medical College. I think that Ms. Emmons has already said that she will give us some additional information about SHARE. But let's look at the project that you're involved in.
Okay, the Clinical Trials Project is one of a nationwide project. The National Institutes of Health through the National Institute of Allergy and Infectious Diseases is funding 55 of these centers around the country, in addition, including the 4 I mentioned. All of us are doing similar activities. There's a list of 100 or so what we call protocols or experiments that we have the option of participating in our local areas. We've chosen here at Meharry and at Vanderbilt to engage in projects that affect populations that we know have the various diseases that we're looking at. AIDS is an unusual disease in that it isn't a disease in itself. What we've learned over the years is that by suppressing the immune system, it opens the gateway for a whole series of what we call opportunistic infections, and these are the dangerous elements of the disease. So what we're looking at in the clinical trials units is to find new medications or new uses of existing medications to treat these various infections, and also, when they're available, to actually treat the HIV infection itself. AZT, the most popular drug of choice for prolonging life and improving the quality of life of an HIV individual, was developed through this same network, and ultimately other drugs and other uses of drugs have come along the same way. Between Vanderbilt and Meharry, we're not doing the same experiments. We're not trying to duplicate each other. We're trying to expand as broad a horizon as we can. We're currently conducting approximately 9 or 10 different experiments looking at different diseases, different aspects of HIV infection, and different ways to treat those. Everything from tuberculosis into some of the oral manifestations of the disease.
Ms. Emmons, you know, as a nurse, let's have you to talk about AIDS as a disease. Of course, I think Mr. Frankel has already indicated that it is not just one disease, it's a whole series of diseases. But in terms of the way that that disease might be contracted and the other things that our audience ought to know about it. I know that we've talked about this many, many times before, and there are the usual signs and et cetera. But I think that each time that we meet, we have to really start back at the beginning. What is AIDS?
The acquired immune deficiency syndrome that's characterized by many things or many symptoms where the immune system is actually attacked by a virus and then is rendered helpless. So when the person has a deficient immune system, then the body is then set up so that opportunistic infections can come in and invade the body. And where normally a person will be able to fight off certain diseases, and such as pneumonia and other opportunistic infections, because the immune system is depleted or deficient, then they are not able to do that. And so a lot of people are succumb to the various infections.
Now, Mr. Frankel,